In this video, I am going to discuss about the circle of Willis. Let's begin with the parts of brainstem. Here is the medulla, this one is pons, and this one is cerebral peduncle of midbrain. Here is the interpeduncular fossa. Pair of vertebral artery enter the skull through foramen magnum. They runs upward on the anterolateral aspects of the medulla and merge with each other at the lower border of pons to form basilar artery. Basilar artery runs upward in the midline on the anterior surface of the pons and reaches its upper border. Here, basilar artery terminates by divide into right and left posterior cerebral artery. Before moving forward, let's discuss the branches of cranial part of the vertebral artery. Spinal branches arises from the each vertebral artery at the upper part of the medulla. These spinal branches join with each other to form a single anterior spinal artery which runs downward along the anterior median longitudinal fissure of the spinal cord. Anterior spinal artery supplies the central part of the medulla and anterior two-thirds of the spinal cord. Near the lower end of olive, posterior inferior cerebellar artery arises from the vertebral artery that winds around the medulla and supply the dorsolateral part of the medulla and cerebellum. Posterior spinal artery arises from the posterior inferior cerebellar artery. The two posterior spinal arteries together supply the posterior one-third of the spinal cord. Several small meningeal branches and medullary branches arises from the cranial part of the vertebral artery. Meningeal branches supply the dura mater of the posterior cranial fossa, while the medullary branches supply the medulla. Now, I will tell you the branches of basilar artery. Anterior inferior cerebellar artery arises from the basilar artery close to the lower border of the pons. It runs backward and supplies the anterolateral portion of the inferior surface of cerebellum. Labyrinthine artery, after arising from the basilar artery, runs along with eighth cranial nerve and enters the internal acoustic meatus to supply the internal ear. Close to the superior border of the pons, superior cerebellar artery coming out from the basilar artery. It supplies the superior surface of the cerebellum. Numerous short slender pontine branches emerge from the basilar artery which pierce the pons and supply it. Apart from the vertebral artery, another major artery which supply the brain is internal carotid artery. Internal carotid artery enter the skull through carotid canal and after traverse a short course, it finally comes to lie lateral to the optic chiasma. Here, internal carotid artery terminates by dividing into larger middle cerebral artery and a smaller anterior cerebral artery. Anterior cerebral artery runs forward and medially above the optic nerve and comes very close to its fellow. Right and left anterior cerebral artery gets connected with each other with a short transverse anterior communicating artery. Posterior communicating artery arises from the internal carotid artery close to its termination. It runs backward and connects the internal carotid artery with the posterior cerebral artery. Around the interpeduncular fossa, you can see a hexagonal arterial circle. This arterial circle is known as Circle of Willis or Circulus Arteriosus. Obviously, branches of vertebral artery and internal carotid artery takes part in the formation of circle of Willis. Circle of Willis is formed anteriorly by the anterior communicating artery. Anterolaterally, it is formed by the anterior cerebral artery. Posterolaterally, it is formed by the posterior communicating artery. Posteriorly, it is formed by the posterior cerebral artery. Thanks for watching. To watch more videos, please subscribe my channel Smart Math Learn and go to playlist.